Hi, this is Dr. Bob Dannenhoffer. This is a video that shows how our drive-through works. So I'm making believe I'm the patient here. So I'm sitting in the passenger seat of the car, and my lovely wife here is driving. And we're here at the Douglas County Fairgrounds. As you can see, a big facility far away from anything else around. And so it's pretty easy. We drive through, we have signage that says COVID-19 testing, and then we drive through here. Generally, we do not have a big long line, and we don't have a big long line because we don't want people to wait for a long time. We now check in here, and this is the time we keep our windows up. And what we would typically do here then is they would know we're coming. They would know we're coming, and we would typically show an ID at the window so we can be sure it's the right person. We then drive through. And it's a relatively short drive-through. We have tents set up in case it's raining. Today it's a pretty nice day, and so we're not going to use the tents. And then we would drive up and we would drive through to our first station here. And they are today in the tent here. And as you can see, we have two people manning the front, and a sign that says both stop and keep your windows up. So we started the clinic today at 12:30. Many of the people who show up for this are anxious and come a little early. So when you set up your clinic, you should probably consider that most of the people you're testing are going to be elderly people, and we all show up about 30 minutes early, especially for something that's free. As we then drive up here, you'll see our two validators here will do this. As you can see, the window says keep the window rolled up and call 541-530-5917. So no need to open the window, as my wife here is going to dial the phone here and talk with them. Put her on speaker if you can.
Hi there, how you doing?
We're doing great. We're here for a test today.
That's good. Okay, I assumed you were here to get tested for COVID. Can I see your identification?
Yes, here it is.
Okay, Dr. Bob. I think we got you on the list.
All right. Well, great.
All right. My buddy's going to put a name tag underneath your windshield wiper.
All right.
Okay.
So they put a name tag under the windshield wiper so they know who we are. And we usually put it on the side of the... Put it on the side where the person is, so that when the testers come through, they know which side to go ahead and swab. In addition, we hand out masks for people
I also want to verify there are two of you in the car. Is it one person being tested today or two?
She wants to be tested twice. No, I'm only kidding. It was just me getting tested on this side.
Okay, all right. If you can crack your window just a little bit.
And so this is the only time here.
A blue card. It has some really good information on it. I want you to read that when you get home, okay?
Will do.
Go ahead and roll your window back up. The mask is your prize for coming in today.
All right.
Appreciate it.
Thank you so much.
Go right on through, and you can go right behind that red truck. They'll take good care of you.
All right. Thank you so much.
You're welcome.
Our next step here is going to be to enter the area underneath the grandstands. When I flip this around, you'll be able to see that our grandstands here offer a particularly good place to do it. The area underneath the grandstands is covered. It's quite private, and it really gives a straight shot for people to move on through. The only disadvantages we found with this is it's relatively dark in comparison to the outside, so you may notice that when we do the video, and it sometimes can get cold. So we do, during times when it's anything less than 60 degrees, provide space heaters, because doing swabs for a couple of hours, it can get pretty darn cold. So the next step here is to move up to the grandstands here. And as we drive up here, we have a traffic control person here. So typically, in the first times you do this, you're going to want more traffic control. We've done this so many times that we have two at that first booth, one traffic control here. as you'll see as we get into this dark tunnel here. They know we're coming, so they have us wait with a little cone in the front here to be sure that we don't do it. One of our biggest concerns on this is that people are nervous. Sometimes people are sick, and when they're sick and nervous, they forget driving. So we want to be really careful to do safety. We would hate to swab for COVID and have one of our people run over. We're now entering the tunnel, and you can see it's going to get pretty dark in here, but we are well protected from this. We have another traffic control person right before they stop. Initially, we didn't do this, and it slowed it down because people drive so slow in this darn tunnel that we want people that this extra control person is great. And now it's our time to get there. So we're moving up here, and we'll introduce you to our staff. So if you'll stop here, we have our infection control person to be sure that all of our infection controls there. You can see our two heaters there. And then we have our two swabbers here. We have one of our nurse midwives and other people doing it, and then Tori in the background, who has done most of these, and her job is to go ahead and label the tubes and be sure that everything gets done. At this point, we stop. They ask us to put the window down, and this is the first time the window comes down. How are you guys?
Good.
Well, we're doing a video here to show Union County how to do this. So you can see these guys are dressed. They have Tyvek suits, and they're using PAPRs.
Yep.
And it works great. So they get 99.7% protection. Tori in the background has a surgical mask and swab, and that's it. So at this point, they would go ahead and do it. You don't actually need to go ahead and do the swab. They know how to do it.
You don't want to do it again, huh?
Oh, sure. No. Anyway, so we'll get it done. So this is what happens. So the total throughput we have, it's only 12:45 now, and they've already done five.
At least, yeah.
So they've done about 2 or 3 minutes per person, and then they get it done.
We've actually done 8.
Okay, they did 8 in 15 minutes, so 2 minutes, less than
Not that
2
we're
minutes.
competitive or anything.
Yeah, they
Yes,
are.
we did
They are a little competitive.
Yeah,
And
we're averaging 2-3 minutes per person.
well, good. And then Tori and I are going to go and do this in Sutherland tomorrow, in a different Reedsport tomorrow, in a different situation, but a pretty good situation. All right, thank you guys so much. All right, take care.
See you.
All right, and then we get done, and we drive out. And on the way out, we have one last traffic control person. So we have 3 traffic control people, 3 swabbers, and 2 screeners. So for 8 people, we can go ahead and do as many as 48 in 2 hours. A sign here, are you safe to drive? We give the thumbs up that we are, and we're good to go. Again, Bob Dannenhoffer here, doing a video on how we do our drive-thru. Take care.